I'm Dr. Gary Ferguson, and I'm the Wellness Coordinator for Eastern Aleutian Tribes. And being a naturopathic physician, a lot of what I do is primarily focused on diet and lifestyle. And so a lot of what I do in the Eastern Aleutian and also Pribilof Island region is to reinforce healthy eating habits and lifestyles that are conducive to wellness and ideally prevent disease or optimize patients' wellness who have different diseases, such as diabetes, which is a primary focus of mine, and also identifying other contributors to disease, such as tobacco prevention and addressing also the issues around substance abuse, alcohol. And a lot of what I do is prevention-oriented, though. Often we look at tying nutritional status and eating a traditional diet to health and wellness. And sometimes the question goes out is, what about people who have left their traditional diet and eat a more westernized diet? You know, what about them, and is there any research or studies that show that changes health status? And one area that I'd like to talk about is Dr. Weston Price, who is a dentist that actually traveled the world and researched indigenous populations. His study in Alaska was primarily with Yupik of the YK Delta region, and some of his studies show that those that lived closest to Bethel area, which was the ship's store, the closer you were to Bethel, the biggest change in your mouth, your dentition, and the more dental caries you had. In fact, he found that those that lived and ate a traditional diet and didn't eat at all Western foods didn't really have a dentition problem. They didn't have dental caries, or very few, if any. And the closer you got to the ship's store, you had changes not only in dentition with dental caries, it changed the mouth structure, actually, as far as the way that the teeth formed. And he also saw signs of malnutrition, as far as like people were not well fed. Foods that are high in fiber, it's kind of interesting to look at the early Unangan diet. It did have diet that was high in fiber due to the plant consumption from the petrushkis on the beach, which were used as a condiment and eaten with meats and other seafood, to the berries and other kinds of greens, the puchki or the cow parsnip. You know, they added these all together so that you had not only healthy forms of protein, but also fiber, and also as far as like the carbohydrate consumption was very low compared to the current Western diet. And so I think that's part of the challenge that we see. Unangan people have developed a diet that's high in carbohydrates, and that's a huge shift from their traditional diet. A lot of foods that are popular, from pilot boy crackers to Laudex or fry bread. These are foods that were introduced that are wonderful. They taste great, and many of us grew up on them. They're to be eaten in moderation, but in a diet that's high in not even complex carbohydrates, simple carbohydrates, we find that we gain weight easier, and we get the metabolic syndrome, which is a combination of high blood pressure, a change in our healthy fats, and predisposition towards diabetes or impaired fasting glucose or glucose tolerance. Looking at traditional foods and how they help prevent chronic disease, one of the main areas of my current focus is in diabetes and diabetes prevention. And we find the diabetes prevalence rates in the Aleutian region being very high. Especially over the last 10 years, we've had the largest increase in diabetes in the whole nation. Looking at some of the root causes really is our challenge. And of course we can treat diabetes, but studies show that if you can prevent diabetes or at least delay its onset, you've gone a long way to help patients' quality of life, as well as helping with them and their wellness. As we look at cancer, people who are nutritiously fed and eat a diet that's high in nutrient-dense foods tend to fare better with cancer. And as we look at people's nutritional status and people who eat a diet that's high in nutritious foods, and traditional diets are known to have nutritious foods, we see cancer rates that are, or at least survivability rates in polling, the patients that I've polled have done much better with a nutritious diet than those who don't eat well. So just another way to look at not only optimizing your health when you have cancer, but also preventing cancer. You know, feeding your body has a better ability to fight. Your immune system works better. People who don't have a diet that's high in nutrition tend to get more colds and flus. Those are kind of symptoms that something's not right, and if you don't give your body the nutrition that it needs, then often you're walking around and you're just not feeling the way that you could feel. And again, it's just a healthy plug or a traditional diet, or a diet that's at least filled with nutritious foods. You feel better, and you tend to be more connected to your environment. And of course, it goes in line with not just eating traditional foods and a healthy diet, but also having healthy habits, not smoking, not abusing alcohol, taking care of yourself and exercising. You know, all those factors are really prime contributors to a healthy life. As we also look at cardiovascular disease, which also used to be the biggest killer of the Alaska Native and the Onongan as well, it's second to cancer, which is the number one cause of death is cancer. But in speaking about cardiovascular disease, a lot of our traditional foods, from the fish to the sea mammals that eat the fish and live off the beach, they're very high in the omega-3 oils. And when we look at these healthy oils and the prevention not only of diabetes and cardiovascular disease, it helps prevent a whole host of different diseases. A lot of the autoimmune diseases are also linked to diet and nutrition. So when we look at these healthy oils, they're very good for preventing a lot of diseases. Interesting to note, the Gokadan study, which is in Norton Sound, studies that show that those that ate the traditional seal and seal oil and salmon had very low rates, if any, of diabetes prevalence. Really tying that in and translating that to our Onongan people is really important, and looking at not only the healthy fats, but within the meat you have the fat-soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K, the B vitamins in the meat, which also is included in caribou and reindeer. And so when we look at cardiovascular disease, that's a huge area. When we start to link it with diabetes, we call that metabolic syndrome, which a majority of our patients are. I just recently queried some of the data amongst at least the Eastern Aleutian population, and we found that 97% of our type 2 diabetics are also having cardiovascular disease. So the link between the two is well established. And as we look more and more at those links, we start to trace them back to diet and lifestyle. So again, eating traditional foods and harvesting them yourself, ideally, or participating in the harvest, from picking berries to getting out and cruising the beach for foods that are found on the beach, or going into the ocean. It's a very healthy activity, and the food itself is so very nutritious for you. And also the question goes is why did we stop? Why have we stopped eating certain traditional foods or decline in using them? Maybe it's the store is a little bit easier to get access to foods, and what kind of foods are we eating? As a physician who asks people what they eat, and we do diet diaries, I see a lot of processed foods, and a lot of foods that are very low in nutrition as far as for the calories consumed. And so in looking at certain diets, people will gain weight because they're highly caloric and filled with kind of quickly satisfying sugars and fats, but actually are very low in nutrition. So we see people that are actually obese but are starving to death as far as nutrition is concerned. That doesn't happen when you're eating a traditional diet. All the foods in a traditional diet are highly nutritious. And there's a sense of satiety or fullness when you eat traditional food that you don't get often with some of these highly processed foods that your body craves more and more of, that actually you're hungry for the nutrition. So I really like to reinforce that when people are looking at traditional foods and incorporating them in their diet or reincorporating them in their diet. So some of the foods that I'm currently really excited about are one that some of our elders from the region, I'm from standpoint originally, elders used to say, when the tide is low, the table is set. There's a lot of nutritious items on the beach that can improve your wellness. And one thing that I find about kelp, or the seaweed family, is that it's an excellent detoxifier. And as we know, our environment is getting more and more polluted over time. Kelp, even though it may also absorb some of the toxins in the ocean, also still maintains its ability to detox the body. So not only does it provide trace minerals and nutrients, but it also is an excellent detoxifier. So it can help us in our environmental challenges to stay healthy. But most of the people I talk with don't eat kelp as often, or if at all, including elders. We've had years of not necessarily eating certain traditional foods. Picked podarches the other day with an elder, and even myself, having grown up in the area, I haven't picked podarches for 12 years probably. Many people say the same thing. Oh, I haven't eaten podarches since I was a kid, if they did that at all. And so we see current generations that are growing up without access to the table, the healthy table that's set for us traditionally. One area that's brilliant about traditional foods and culture is that it enhances community. And one thing that I think that has been the challenge with our Aleut and Ungan communities is people are saying, you know, my community isn't the same as it was when I was a kid or when my grandparents were young. We're not as much of a community anymore. And I find that getting together and collecting traditional foods is a great way to build community and reinforce community, and the sharing that goes with the traditional food. It's just innate within Unungan culture to share your foods, your bounty, and I think it re-energizes communities that get together to collect traditional foods and to celebrate the whole culture surrounding them. Unungan culture was rich in community, and I think that that's one area towards health and wellness that often doesn't get addressed, is people feel isolated and they don't feel connected to their community like they used to. And one way to reintegrate that is to remember the traditional foods and to get out there and collect them together. It really reinforces this important concept of relying upon one another. The Aleutians being so remote, we often forget when we're in our Aleutian communities that, you know, we are where we're at and that we need each other. And the TV and the internet and staying inside doesn't serve us health-wise. You know, getting out, getting healthy by being active and collecting traditional foods and interacting with each other is really important.